What if I told you that high blood pressure is not always a life sentence and that for many people, it can actually be reversed? Not controlled, not just managed with pills, but genuinely improved by fixing the real causes doctors often don't have time to explain. Stay with me because in the next few minutes, you're going to learn what truly works and what most people are doing completely wrong. High blood pressure, also called hypertension, is often called the silent killer. You don't feel it, you don't see it. Yet quietly, day by day, it damages your heart, your brain, your kidneys, and your blood vessels. Millions of people take medicines every morning believing that's the only solution. But here's the uncomfortable truth. Medication lowers the numbers, not the root cause. And if the cause remains, the problem quietly continues. Now let me be very clear from the start. This is not about stopping your medication suddenly. That can be dangerous. This is about understanding why blood pressure rises in the first place and how the body can heal when those reasons are addressed correctly. Think of your blood vessels like flexible garden hoses. When they are healthy, blood flows smoothly. But over time, due to poor lifestyle habits, stress, inflammation, and hormonal imbalance, those vessels become stiff and narrow. When that happens, the heart has to pump harder just to push blood through. That pressure you see on the monitor is not random. It's your body struggling to cope. For decades, we were told one simple story. Eat less salt and take your pills. While salt sensitivity matters for some people, it is only a small piece of a much bigger puzzle. Many people cut salt, take medicine, and still their blood pressure stays high. Why? Because the real drivers are still active inside the body. One of the biggest and most ignored causes of high blood pressure is insulin resistance. When you eat too much sugar, refined carbs, and ultra-processed foods, your blood sugar stays high. Your body releases more insulin to manage it. Over time, insulin stops working properly. This causes your kidneys to hold on to sodium, your blood vessels to stiffen, and your nervous system to stay in fight or flight mode. All of this pushes blood pressure upward. This is why people with belly fat, prediabetes, or type 2 diabetes almost always struggle with hypertension. The body is inflamed, overloaded, and stressed from the inside. Another major factor is chronic stress. Not short-term stress, but the daily kind, the financial worries, poor sleep, constant phone use, news overload, and emotional tension. When stress hormones like cortisol and adrenaline stay high for too long, they tighten blood vessels and raise heart rate. Your body thinks it's in danger even when it's not. Blood pressure rises as a survival response. Then there's poor sleep. This one surprises many people. If you sleep less than 6 hours regularly, or if you snore heavily and stop breathing at night, your risk of high blood pressure doubles. During deep sleep, your blood pressure is supposed to drop and your vessels repair themselves. When sleep is disturbed, that repair never happens. Now, let's talk about something very important: why lifestyle changes actually work, and why doctors who truly understand hypertension emphasize them so strongly. When people improve their diet, start moving their body, manage stress, and fix sleep, something powerful happens. Inflammation reduces, blood vessels relax, hormones rebalance. The nervous system calms down. Blood pressure doesn't drop because of force, it drops because the body no longer needs to keep it high. This is why in real clinical practice, some patients are able to reduce their medication over time under medical supervision because their readings consistently improve. One of the most effective changes is food quality. Not dieting, not starving. Just switching from processed foods to real, whole foods. Vegetables, fruits, healthy fats, beans, nuts, seeds, and clean proteins give your body minerals like potassium and magnesium that naturally relax blood vessels. They also reduce inflammation and improve insulin sensitivity. Regular movement is another powerful medicine. You don't need extreme workouts. A daily 30-minute walk can lower systolic blood pressure by 5 to 10 points. Gentle strength training improves circulation and makes blood vessels more responsive. The key is consistency, not intensity. And then there's breathing. Slow, deep breathing activates the parasympathetic nervous system, the body's natural calm mode. Just 5 minutes. A day of slow breathing can measurably reduce blood pressure by lowering stress hormones. All of this may sound simple, but simple does not mean easy. The reason many people fail is not lack of knowledge. It's lack of a clear, realistic plan and the belief that nothing will help me anyway. In the next part, I'll explain the most common myths about reversing high blood pressure. Why some people don't see results even when they try and exactly which habits make the biggest difference according to real medical evidence, not internet hype. One of the biggest myths about high blood pressure is that once you have it, you're stuck with it forever. This belief keeps people passive. They stop trying. They rely only on pills and assume their body is broken beyond repair. But in reality, blood pressure is a dynamic measurement. It changes based on what you eat, how you move, how you sleep, and how your nervous system is functioning. Another common myth is that if your blood pressure runs in the family, there's nothing you can do. Genetics do play a role, but genes load the gun, lifestyle pulls the trigger. Studies consistently show that people with a strong family history can still dramatically improve their blood pressure when they change how they live. Your genes are not your destiny. Now let us talk about why some people do everything right and still don't see improvement. This is where frustration sets in. Often, the issue is not effort, it's focus. People try 10 changes at once, burn out, and quit. Or they focus on the wrong things, like obsessing over salt while continuing to eat sugar, refined carbs, and processed oils that silently damage blood vessels. Another reason is inconsistency. Blood vessels don't heal in a week. It takes weeks to months of steady habits for the body to remodel and relax. Many people give up just before results would have appeared. There's also the issue of hidden contributors. Excess alcohol is a big one. Even moderate drinking can raise blood pressure in sensitive individuals. Dehydration is another. When the body lacks enough water, blood becomes thicker and pressure rises to maintain circulation. Let's also address supplements because many people ask about them. Magnesium has strong evidence for helping relax blood vessels and improve blood pressure, especially in people who are deficient, which is very common. Potassium from food, not pills, is another key nutrient that balances sodium and supports healthy pressure. Omega-3 fats can reduce inflammation and improve vessel flexibility. But supplements alone are never a cure. They work best when lifestyle is already improving. Now, an extremely important point. When blood pressure improves naturally, it often improves slowly but steadily. That's actually a good sign. Fast drops can be dangerous, especially if someone is on medication. This is why doctors emphasize monitoring and gradual adjustment. Let's talk about the role of weight, but in an honest way. It's not about appearance. Extra fat, especially around the abdomen, releases inflammatory chemicals that damage blood vessels and increase insulin resistance. Even a 5 to 10% weight reduction can lower blood pressure significantly. This isn't about perfection, it's about progress. Another overlooked factor is muscle loss with age. As we get older, we lose muscle and blood sugar control worsens. This directly affects blood pressure. Light resistance training, even using body weight, helps restore metabolic health and improve circulation. And now, something many people don't expect: your mindset matters. When people feel powerless, stressed, or fearful about their health, their nervous system stays activated. When people feel informed and in control, stress hormones drop, blood pressure responds accordingly. Hope is not just emotional, it's physiological. This is why education is part of treatment. When you understand what's happening inside your body, fear reduces. And when fear reduces, pressure often follows. In the final part, I'll walk you through what a realistic blood pressure reversal plan looks like, who can expect results, who needs medication long-term, and how to work with your doctor safely instead of fighting against medical advice. A realistic blood pressure reversal plan doesn't start with perfection. It starts with stability. The first goal is not to chase perfect numbers, but to stop the damage from progressing. When blood pressure readings become more consistent and less extreme, the body finally gets space to heal. The most successful patients focus on a few core habits and protect them fiercely. They build meals around real foods most of the time. They move their body daily, even if it's just walking. They prioritize sleep as a medical necessity, not a luxury. And they actively calm their nervous system instead of living in constant alert mode. This approach works because it targets the root causes at the same time. Blood sugar improves. Inflammation decreases. Hormones stabilize. Blood vessels slowly regain flexibility. The heart no longer needs to push as hard. Now, it's important to be honest about who can reverse high blood pressure and who may need long-term medication. If someone has had severe hypertension for decades, significant artery damage, kidney disease, or genetic conditions, medication may always be part of their care. And that is not failure. Medication can be life-saving. But even in these cases, lifestyle changes still matter. They reduce the number of medications needed, lower doses, and protect against complications like heart attacks and strokes. The goal is always risk reduction and quality of life. For people in early or moderate stages of hypertension, especially those driven by stress, weight, poor diet, or inactivity, improvement can be dramatic. Many see reductions of 10, 15, even 20 points over months, not days when they stay consistent. Working with your doctor is critical. Blood pressure should be tracked regularly, preferably at home with a validated monitor. Readings should be taken calmly, seated, and consistently. When numbers improve steadily, doctors can safely adjust treatment. This partnership approach is where real success happens. One of the biggest mistakes people make is swinging between extremes, either relying only on medicine or rejecting it completely. The smartest path is balance. Use medicine when needed. Use lifestyle always. And remember this, your body is not your enemy. High blood pressure is not your body trying to harm you. It's your body adapting to stress, overload, and imbalance. When those pressures are removed, the body responds. Many people feel overwhelmed when they hear all this. But you don't need to change everything today. Start with one habit, one walk, one better meal, one earlier bedtime. Small changes, repeated daily, create powerful results over time. High blood pressure reversal is not about quick fixes or miracle cures. It's about understanding your body, respecting it, and giving it what it needs to heal. High blood pressure doesn't appear overnight, and it doesn't reverse overnight either. But the most important thing to understand is this: your numbers are not random, and your body is not broken. Hypertension is a signal. A signal that something in your lifestyle, stress level, metabolism, or daily routine needs attention. Medication can be necessary, and for many people it is life-saving. But medicine works best when it's supporting a body that is moving toward healing, not fighting against it. When you improve how you eat, how you move, how you sleep, and how you manage stress, you are not trying alternatives. You are addressing the biology of blood pressure itself. Real reversal doesn't mean throwing away pills. It means creating an environment where your body no longer needs to keep pressure high just to survive. For some, that leads to lower doses. For others, better control and fewer complications. For everyone, it means a stronger heart, healthier blood vessels, and a longer, better quality of life. If you take one thing from this video, let it be this: small, consistent changes matter more than perfect plans. Start where you are. Work with your doctor. Track your progress. Give your body time. Because when you stop fighting symptoms and start fixing causes, real change becomes possible.